From Michigan State Police records, the rap sheet on the woman we'll call felon number 1. Felony attempted breaking and entering, felony larceny, felony stealing, felony credit card theft, felony prison escape. And then we hear this from her past supervisor at Alliance Home Health Services.
My concern was for her, working with their social security number.
Some of our most vulnerable patients, social security numbers, Medicare numbers, personal information, all in the hands of somebody with that kind of criminal history?
To be such a habitual offender like that, I mean, obviously you don't learn a lesson.
Former Alliance employee Jennifer Fleeman says felon number 1 worked for her when she was a supervisor there. She tells us Medicare numbers, which in many cases are Social Security numbers, were readily available to all employees at the company. She says all the workers, many of them telemarketers, had to collect the information to ensure the patient would qualify for Medicare homebound medical service.
Being able to work with so many elderly people and make them so happy.
After Fleeman left the company in May 2013, she says felon number 1 got promoted and actually took Fleeman's job as a supervisor. We wanted to find out if felon number 1 still working at Alliance with direct access to patient information. We went to the address we confirmed from multiple sources as the company's marketing headquarters, and we ended up right at felon number 1's office door.
Hi, David Bailey from Channel 3. Are you the marketing supervisor here?
The door slammed in our face.
Can you come talk with us a little bit? We'd like to ask you some questions.
She didn't tell us anything about her apparent current employment at Alliance. We found in state documents there might be a good reason why she locked the door on us. Through the Freedom of Information Act, we found that felon number 1 was disqualified from working in home health care, but somehow continued working even as the folks inside this company promised state regulators last year felon number 1 was, quote, not an employee anymore. In felon number 1's case, state documents show she has to wait until 2019 to work at a home health agency. By law, most felons have to wait 10 years after they're out of the justice system to get in the field. Some have to wait 15 years, in fact, if they've done time for things like criminal sexual conduct and abuse. Those with qualifying misdemeanor convictions even have to sit out 5 years. So we turn to the man who created and owned Alliance Home Health Services from 2006 up until February of 2014, Mark Cataldo. We walked straight into his office at Alliance. He escorted us out of the building, then wanted to hit the road in his vehicle.
Why are you running away from us? Why are you running away? I mean, if you have nothing to hide, why are you running? I mean, just talk with us. Sit down and talk with us.
Then he decided he didn't want to drive away, got out of his vehicle and walked back inside his company. Before he left us, I asked a final question.
Do you have a person with a felony background handling information?
Cataldo closed the door on us. He shut the door about the same time regulators at the State Department of Licensing and Regulatory Affairs opened the door for us to find out what we knew about this company. After we told him what we knew, Lara's director for health facilities, Larry Horvath, promised us in this case he would
determine if that allegation had substantial information that shows, that the provider is willfully and knowingly violating the law.
He told us there's punishment in the law for executives at home health care agencies that don't follow laws in the public health code.
A home health agency must stay compliant with state law. So if we found that they were in violation of this part of the act, which requires background checks, and they knowingly and willingly violated this part of this, and we found them in non-compliance with this, then we could cite them under a federal provision that would also risk their federal certification and participation in Medicare.